This is WFYI News Now. It's August 30th, and I'm Zach Bundy, sitting in for Abriana Heron. On today's show, Indianapolis City-County Council wants to raise the pay for several positions, including the mayor. And Indianapolis will get $15 million in federal funds for EV stations.
And since we host most of the air pollution, we should also reap all of the benefits of the reduction of air pollution and greenhouse gases.
Those stories coming up, but first, the next installment of our regular segment called The Checkup from Side Effects Public Media, where the health reporting team explores a single question sparked by a recent news story or maybe by one of our listeners.
So we're back today looking at the latest with COVID-19 vaccines. The Food and Drug Administration last week approved 2 updated COVID-19 vaccines to help protect people from the latest strain of the virus. Today's checkup question is, should I get the newest COVID vaccine? I'm Lizzie McGreevy, Side Effects Public Media Community Engagement Specialist, and I'm joined today by health reporter Ben Thorpe.
Hi, how's it going?
Oh, just thinking about COVID and trying to figure out if we should get this booster. So I'm hoping that you can start us off by talking about why do we even need a COVID booster right now?
Yeah, so right now we're seeing a spike in COVID activity across the country. Nationwide test positivity has been climbing and is currently at about 18%. Here in Indiana, we've been seeing hospitalizations for COVID picking up, going from a 7-day average of about 29 at the start of June to about 200 here at the end of August. Dr. Mandy Cohen is the director of the Centers for Disease Control and Prevention. She says immunity from previous infections provides some protection, but vaccines are still really important for us to get.
We know that protection decreases over time, and certain groups continue to be at higher risk from COVID and other viruses, and we need to continue to protect ourselves and our loved ones.
The other thing worth mentioning is Cohen says COVID mutates faster than the traditional flu virus, which is why staying ahead of it is so important.
Okay, so the mutating seems important. Does that mean that the COVID boosters that are coming out are targeted for the latest mutation of this disease?
That's a great question. They're actually not. These latest boosters are aimed at something called the KP2 variant. And right now we're on KP311 variant, which, just based on basic numbers, you can probably tell comes later. But right now that one is the most prominent variant here in the U.S.
Okay. Those sound like Apple operating system updates to me, but I will trust you with that.
Yeah, they really do, don't they?
So our vaccines are for the older variants. Is that going to be an issue? Are we going to be protected against newer variants?
So experts say that the vaccines are still going to provide some defense here. Right now, all of these variants are evolutions of the Omicron COVID variant. And so because our vaccines are targeted to something that's in a similar family, let's say, it should still provide some defense. Dr. Peter Marks is the director of the Center for Biologics Evaluation and Research at the Food and Drug Administration. He says the concern right now isn't that vaccines won't provide defense against new mutations. It's that people aren't getting their vaccines at all.
So I think the point of this campaign is that if you have someone in the office and you can get them to get a COVID-19 vaccine, that is probably better even than what we have now, which is people who haven't had a COVID-19 vaccine for 1 or 2 years.
All right, so you've spoken to experts, you've given me some data. I am ready to go. How do I get my vaccine?
Yeah, so I reached out to our local health department, and they are telling people to check in with their local pharmacies to see who might have access to it already. They're also reminding people to get that regular flu shot, which you're talking about, Lizzie, while they are there. Melissa McMasters is a registered nurse at the Marion County Public Health Department in Indianapolis and the administrator of the Immunization and Infectious Disease Program. She says they don't have the vaccine just yet.
And as soon as we do have the vaccine available, we'll put out a release about that.
And right now, anyone older than 6 months is recommended to get that vaccine.
Ben, thank you for that timely update as we are approaching flu and it seems like COVID vaccine season. I will be in line to get my COVID vaccine when my pharmacy has it, so I appreciate these updates. If you have questions that you're too afraid to ask your doctor, more questions about COVID or flu season, or just anything you would like us to cover here on the Checkup, please don't hesitate to reach out. Until then, stay safe. Bye, Ben.
Bye.
That was The Checkup by Side Effects Public Media. Side Effects is a regional health reporting collaboration of NPR member stations across the Midwest, based here at WFYI. Indianapolis City-County councilors are looking to increase pay for several positions, including the mayor's office. WFYI's Samantha Horton reports.
The current salary for the mayor of Indianapolis is $95,000. That was set in 2002, the last time the mayor position had a pay raise. Under the proposal, the City-County Council would bump the pay to $125,000. But not everyone's on board, including Mayor Joe Hogsett. In a media statement, Hogsett said that his position has and remains to forgo any pay raises while serving as mayor. He made it clear he would veto any proposal that included a pay raise for his position. Tuesday night, the Administration and Finance Committee tabled the proposal, and it is unclear if it will be amended to remove the pay increase for the mayor. Other executive positions that are being considered for raises include the county assessor, auditor, recorder, and clerk. I'm Samantha Horton.
And for our final story today, Indianapolis will receive $15 million in federal funds to increase access to electric vehicle charging stations throughout the community. WFYI's Aubriana Herron reports the project will prioritize locations with both growing EV demand and environmental justice concerns.
The funds are planned to close gaps within INDOT's electric vehicle infrastructure plan by adding more EV chargers throughout Indianapolis and placing them in disadvantaged areas. Denise Abdul-Rahman is a leader of a statewide EV Equity Alliance. She says the city partnered with the alliance to ensure EV implementation includes input from minority communities.
And since we host most of the air pollution, we should also reap all of the benefits of the reduction of air pollution and greenhouse gases.
Abdul-Rahman says the funds will create jobs and improve health outcomes for all Indianapolis residents. The grant is part of the Biden administration's goal to support EV infrastructure growth throughout the nation. I'm Aubriana Herron.
That's all for today's episode of WFYI News Now. Our podcast is produced by Drew Daudelin and me, Zach Bundy, with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes. Kendall Antron produced our music, and filling in for Aubriana Herron, I'm your host, Zach Bundy. If you liked today's episode, remember to subscribe and share, and follow WFYI on Instagram, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back next week.